Okay, Jash also asks, how often do I need to revisit to reduce bodily pain long term? Well, I've addressed this in a couple of the questions in a couple of the other videos, but it's an important question, and it needs to be answered in as many ways as possible. So, long-term relief of a problem, assuming you can achieve long-term relief of a problem. And chiropractic is probably your best bet when you have a biomechanical problem, a physical problem where a joint's not functioning, that we can actually get the area to function. It doesn't do any good to do a lot of exercises if you're not allowing the joint to function properly. So again, this is the model I use. This is mobility. This is normal mobility in the spine. So this would be abnormal. You have an area that doesn't move and then an area that has to overstretch. Now, what if you get this area and you start exercising? And you exercise more and you stretch more. You're probably going to be in worse shape afterward than you were to begin with. That's a lot of the reason why people will get into exercise programs or sometimes even physical therapy. They find, I've had people come to me because they've gone to physical therapy first because that's who their primary doctor referred them to, but they felt worse. And the reason is simple. If you don't get this area to function properly before you start the exercise program, then you're more likely to cause irritation than anything else. Sometimes the worst thing is to actually get rid of the pain, but the person doesn't know that this area is still not functioning properly. So it's like, sort of like getting a broken bone put in a cast before you set it. So you want to get those areas that aren't functioning to function properly. And there's no magic bullet anywhere for anything, despite what you might think. There's no magic pill you can take or shot you can get, or even chiropractic adjustment that you can get that's going to make everything normal in one try. So depending on the person's age, depending on their physical condition, depending on what happened to them, were you in a car accident or did you just tweak your back playing basketball? There's a lot of different factors. What do you do with your life the rest of the time that you're not in the chiropractor's office? Are you sitting in front of a computer for hours and hours? So if you want to get well, it depends first of all what your goal is and what you consider being well. So is it just pain relief? Well, if it's pain relief and you're a young person that just tweaked your back or neck, it might take one visit, it might take two. If you're an older person and just want pain relief, sometimes it might take a dozen just to get you out of pain because there's so much degenerative change that's already happened. And if you're of that mindset when you just want something to get you out of pain and that's all you want, you probably have neglected your spine. I always say that if people treated their teeth the way they treat their spine, we'd all need false teeth by the time we were about 40. So you need to do exercises, and this is all part of what I do in my office. It's all part of the recommendations I make for people. So we need a certain number of visits to get the joint functioning normally. We want to get these red areas to move more like these brown areas, depending on how old you are, how much degenerative change there is. It may take, the goal might not be to get these to move like this, but just to get these to move a little bit better. Because if you get these to move a little bit better, that reduction in the pressure, which is what causes the pain nerves to fire, will get sometimes below the threshold of the pain nerves, so they won't fire anymore. So you can get a little bit of motion, and with older people, Medicare patients I have, sometimes that's what we're trying to do. We're just trying to get enough motion back so that the pain will be, with some people, it's even just to have the pain be bearable, that the person can get on with their lives during the day without being in so much pain they have to lay down or whatever. So we're trying to get people's bodies to function better. And the sooner you get to the chiropractor and make sure that everything's functioning normally, the better. And then, of course, you have to do what you need to do to maintain it. So the answer to your question is of how long it's going to take long term is it depends on a lot of different factors. And mostly it depends on what you're willing to do to make sure that your body is in as good shape as possible. Because you're young people now, you're not going to be so young, and you're going to be looking back and realize that time's going very quickly. So taking care of yourself now is the best thing you can do. They talk about saving 10% of your earnings, and this way when you're older, you'll have a nice nest egg. Well, you also need a nice health nest egg, because your money is not going to be that beneficial to you if you don't have your health. You're not going to really care that much about how rich you are if you're not healthy. So that's my advice to you.